We are starting with the revision of the immunization chapter. Immunization chapter is very important. So we'll see, like in India, 30% of the population is less than 15 years and 40% is less than 6 years. So we are targeting in immunization population less than 16 years. So it is very important. We know Mission Indradhanush. Mission Indradhanush had seven vaccine preventable diseases, that is DPT, measles, TB, polio, and hepatitis B. DPT, measles, and TB were earlier, and polio and hepatitis B were added. For now, we will see for NIS. NIS will be like this: birth 6, 10, 14, 9 months, 16 to 24 months, 5 to 6 year, 10 to 16 year. Birth Hep B, OPV0, BCG, OPV1, pentavalent 1, rotavirus 1, FIPV1, PCV1, then OPV2, pentavalent 2, RVV2, OPV3, pentavalent 3, rotavirus 3, FIPV2, PCV2, MR, vitamin A, JE1, MIPV3, PCV3, MR2, vitamin A, JE2, OPV booster, DP2 booster, 1 DP2 booster, 2 TD. Now in Hep B is a birth dose and it is only given at the birth, and the time for Hep B is 24 hours. OPV 0 given till 15 days. BCG is given till 1 year. BCG live vaccine, live vaccine given in intradermal, all intradermal are given in 0.1 ml, and it is Danish 1331 strain. OPV 0 is given orally, and pentavalent is given IM, left anterolateral thigh. All vaccines given IM are given in left anterolateral thigh till 5 years, except PCE, which is given in right anterolateral thigh. All vaccines which are given IM are 0.5 ml, except measles vaccines, which is subcutaneous and 0.5 ml, given in right upper arm. Right upper arm, the two doses of FIPV are given, FIPV1, FIPV2, but third dose is given in left upper arm, that is intradermal, and the gap between two vaccines side should be 1.5 centimeter, and JE given in endemic areas, OPV given till 5 years, pentavalent, rotavirus 1, FIPV, PCV given till 1 year, MR given till 5 years, DPT given till 7 years, TD given till 7 years, and rotavirus 1 year, Japanese encephalitis till 15 years, Hep B 24 hours, and what I should say, like I think this much is enough for for pregnant females. It is for TD1 given at first antenatal visit after 4 weeks, TD2 given, TD3 is a booster if within 3 years the pregnancy occur and female has taken both TD1, TD2. Live vaccines are BCG, MR, OPV, rotavirus. Gap between live vaccines should be 4 weeks. OPV 0 is added dose, Hep B is bird dose compulsory. Hep B dose prevents MTCT, mother to child transmission, no lifelong immunity. Then maximum age of vaccine we have discussed. BCG live vaccine 0.1 ml intradermal, left upper arm. Side effect will be lymphadenitis. Scar, if scar doesn't seem, don't repeat the dose. Be direct BCG given. In direct BCG, we first do tuberculin sensitivity test in less than 1 month baby. 0.05 ml Danish 131 strain, till 1 year can be given. Heat sensitive vaccine, most heat sensitive vaccine is reconstituted BCG. Pentavalent is DPT. DPT is DPT, diphtheria, pertussis, and tetanus. And diphtheria and tetanus are toxoid, and P is pertussis, which is killed vaccine. And pertussis is acellular pertussis, whole cell pertussis. Whole cell pertussis lead to the side effect that is known as inconsolable neurological deficiency. So it is contraindicated in children having neurological problems. And first acellular pertussis is preferred, but in Government of India, whole cell pertussis is given. And in pentavalent given till 1 year IM, and other are Hep B and H influenza B bacteria. H influenza B bacteria, not virus. Bacteria causes meningitis and pneumonia. OPV, low wound injury, oral till 5 years. Side effect is vaccine associated paralytic polio. Hep B is recombinant vaccine given IM for 0.5 ml, left intralateral thigh. We have discussed this. FIPV, we have discussed this. Rotavirus 5 drops given till 1 year. Intussusception is side effect, so contraindicated in previous abdominal surgery, high risk patients. and there is Rotavac, Rotatech, Rotafix, and Rotavac. There is change of the VVM location. First VVM was on the cap, now on the body, so it is under the open wire policy. That is once open, it can be used for 28 days. You know the work of the VVM. VVM is for used for the heat sensitive vaccines to know whether they are exposed to heat or very much heat or not, whether we should discard them. We know that the inner square color should be light. If it is equal, then it is the discard point. If it is darkened, then it is absolutely discard point. Similarly, shake test is done for free sensitive vaccine like DPT Hep B. It is done to test for the adjuvant. Adjuvant like in the DPT and Hep B is ALOS whole thrice, and if it is exposed to high a very low temperature, then it will precipitate. So clear liquid seen discard. If cloudy, then okay, it is okay. Pentavalent, PCV, MR, till heavier. Side effect is very important. Measles like rash on fifth day, and if it occur before fifth day, then the baby is exposed. Baby was in incubation period. Now in capital D means high dose given to children. Small d means low dose given to adults. AP means acellular pertussis and everything, And TD is given IM, and child is 5 to 6 years. So TD can be given uh, TD can be given in the arms, so brachial neuritis is the side effect. Okay, so gap between vaccine, live vaccine is 4 week, DPT is 4 week, PCV is 8 week, or DPT booster is 6 months, and the OPV booster is 12 months. You know and how to immunize a partially immunized child, completely immunized child. We have discussed about shake test, 1.5 centimeter, 2 week, 2 year. I think this is okay. This whole done, this part whole done. We have done this. No, so now next coming to vaccine in HIV positive child. All vaccines are given, but if a child is symptomatic like stage 3, stage 4, or CD4 count less than 2, and its relative CD4 percent is less than 15%, then definitely all live vaccine are contraindicated. OPV not given in the sibling of the immunocompromised patient due to the risk of development of contact VAP. And now we will discuss cold chain temperature +2 to +8 degrees C. The sequence is walk-in freezer, deep freezer, ice-line refrigerator, cold box, and vaccine carrier. Vaccine carrier, four ice packs are there. Both heat sensitive and free sensitive vaccine can be stored 16 to 20 vials for 36 hours. Cold box, 100 of vials for 48 to 96 hours, and 30 ice packs can be stored. And ice-line refrigerator, top to bottom. Don't don't hurt people in this room because Japanese manners outshine. And in upper part free sensitive, lower part heat sensitive, PM most heat sensitive, polio and measles. And in deep freezer temperature -15 to -25, it is not used for vaccine storage, used for ice pack preparation. Ice pack 0.04 liter water is used, and it has two holes for the putting of the MR and BCG. Other vaccines put are RVV, OPV, and JE, that is the live vaccine. Vaccine sensitive to freezing are Hep B, pentavalent, DPT, and the TT and IPV. IPV is more freeze sensitive than heat sensitive, and ice pack is first go through preconditioning, and then it is used. And vaccine sensitive to heat are BCG, after reconstitution, OPV, IPV, MR, RVV, JE, DPT, BCG, TE, TT, pentavalent, Hep B. This sequence are most sensitive to least sensitive. And VVM we have talked about. There are four types of VVM: 2, 7, 14, 30, and number shows that amount of in how many days the vaccine will go bad. Vaccine will be discarded if it is exposed to the high temperature. And it is for heat sensitive. We have seen shake test, we have seen open vial policy. All the vaccines can be if open, can be used for 28 days except Japanese encephalitis and except BCG and MR. All live vaccine once open need to be once reconstituted need to be used in 4 to 6 hours. Stocking and healthcare centers for PHC is 1.5 month. For district level, it is 2.75 months. You know the working stock, you know lead time, buffer stock, and lead stock. Working stock for PSC is 1 month, for district level is 2 months. Lead stock for PSC is 0.25 months, save for district level. But buffer stock for PSC is 0.25 months, for district level is 0.50 months. Now we will talk about the wastage in vaccine. All vaccines except BCG, J and MR, the wastage factor is 1.11 and percentage is 10%. BCG is 50% wastage, so 2, and J and MR has 1.33, that is 25 to 33%. Okay, vaccine in special conditions. In measles outbreak, MCV 0 given to 6 to 9 month people. Rubella outbreak, women of reproductive age who are not pregnant, adolescents who are not pregnant, infects are given during disaster. NIS continued. TT and Hep B given to the healthcare workers. Child with diarrhea, OPV given. Next, after 4 weeks, the OPV repeated. Now, the yellow fever vaccine, all the other vaccines are like measles, live 0.5 ml subcutaneous, and it effects starts after 10 days, and it is given in pediatrics to the travelers traveling to the yellow fever endemic area. And BCG live vaccine Danish 1331. OPV, you know, strain is very important. Sabin strain. FIPV killed, so Salk strain. Chickenpox also live 0.5 ml subcutaneous. OKA strain. Gap should be 3 months. It is given less than 12 years, 2 to 3 doses. After 12 years, it is given as booster doses. Mumps vaccine, same strain is Jerry Lil strain. Rubella vaccine RA27 is to 3 strain. Plague vaccines work effect starts after 7 days. Malaria vaccine Mosquirix RTS AS01 strain. RTS is repeat region of circumsporocyte protein. T cell epitome of circumsporocyte protein. S is HPS and T surface antigen. Leprosy vaccine MIP Mycobacterium indica Prani. Typhoid vaccine oral TY21A. Live vaccine given more than 6 year age. And then polysaccharide vaccine, conjugate vaccine given to all, given to more than 6 months, and polysaccharide vaccine given only after 2 years of age. Meningococcal vaccine, quadrivalent vaccine, polyquadrivalent polysaccharide vaccines are given after greater than 2 years. Pneumococcal vaccine, conjugate and polysaccharide given after 2 years. Live vaccines are no, first read this. Hmm. Cholera vaccine are Dukoral and Senegal. Dukoral is both are oral. In Dukoral, beta subunit of cholera bacteria is present, so gastric buffer required for this distribution. Senegal, no gastric buffer required. HIV, RAV, recombinant adeno-associated vaccine, and GARA. COVID-19 vaccine, viral vector vaccine, kill vaccine, DNA vaccine, mRNA vaccine, protein subunit vaccine. Kill vaccine is viral vector vaccine is Covishield, Sputnik. Kill vaccine is Covaxin. DNA vaccine is Zycor D vaccine. mRNA vaccine Pfizer and Moderna. Protein subunit vaccine Novavax, Corbevax. Okay, live vaccine names are COVID-19, BCG, OPV, RVV, MR, yellow fever vaccine, chickenpox vaccine, rubella vaccine, influenza vaccine, mumps vaccine, typhoid vaccine, JE vaccine. So now waste disposal, if BMW present, needles in white, gloves in red dustbin, plastics in red dustbin, broken wires in blue, syringe in normal. If not, then all the materials which are coming in contact with the fluid or body or body fluids need to be disinfected in hypochlorite solution 30 to 60 minutes. Sharp things need to be it's carried in the pit, and plastic syringe in recycle. I think this is overlapped. I'm sorry for this. Hmm. So vaccine इसमें हो गया AFEFI एडवर्स इफेक्ट फॉलोइंग इम्यूनाइजेशन प्रोडक्ट रिलेटेड हम कुछ नहीं कर सकते क्योंकि प्रोडक्ट नहीं प्रॉब्लम क्वालिटी रिलेटेड वैक्सीन का बैच खराब आया था तो इसमें हमें काफ़ी ज़्यादा नंबर ऑफ केसेस मिलेंगे इम्यूनाइजेशन एरर या तो हमने सही एंगल पे रख के नहीं किया एल्कोहल स्पिरिट पहले लगा दी तो लाइव वैक्सीन के किल हो जाएगी एंजाइटी रिलेटेड अगर इम्यूनाइजेशन एरर में टॉक्सिक सिंड्रोम हो गया अगर किल्ड वैक्सीन यूज़ कर ली या एक्सपायर्ड वैक्सीन यूज़ कर ली सॉरी या कंटेमिनेटेड वैक्सीन विद स्टेफ ऑरियस कोइंसिडेंटल एरर भी हो सकता है दिस यू नीड टू रिमेंबर टाइम 24 to 48 hours acute hypertensive reaction inconsolable screening anaphylaxis less than 7 days local reaction sepsis and injection site access less than 14 days seizure encephalopathy, less than 3 months brachial neuritis and intussusception, less than 1 year lymphadenitis, osteitis. Now this is your immunization. I have completed along with the revision. You should revise it, and I think you will be fine with this. You will not. You will be confident. Okay.